Hello students, hello to all. Today in this class, I would be taking up the topic from microbiology, Clostridium. Clostridium is basically a group of bacteria. I would be taking just one from this group in this class, which is Clostridium tetani. Briefly understanding about the Clostridium group of bacteria. Clostridium group of bacteria are gram-positive, anaerobic, spore-forming bacilli. In this, there are three types: Clostridium perfringens, which causes gas gangrene; Clostridium tetani, which causes tetanus; and Clostridium botulinum, which is responsible for botulism. Amongst these three, I would be taking Clostridium tetani in detail in today's class. Clostridium tetani, as I have told you, it is a causative organism of tetanus. This bacteria is widely distributed in soil and in the intestine of human beings and animals. It is widely distributed in soil. It remains there for years together. It cannot be destroyed easily. You know this, right? Then, briefly, from the microbiological aspect, if we see its morphology, it is gram-positive, slender, with this size 4 to 8 microns into 0.5 microns. But there may be a considerable variation in length. It's not the fixed size. The bacteria is spore-bearing, non-capsulated, motile, by peritrichate flagella. Peritrichate flagella means small projections of flagella are there. These flagella are basically found in the young spores of this bacteria. And one more important thing about this bacteria is that it is an anaerobic bacilli. These occur singly also and also occasionally are found in chains. The characteristic microscopic feature of this bacilli is that the spores of these are spherical, terminal and bulging. I'll just show you the picture about it also, which gives this a drumstick appearance. This is a characteristic which has to be remembered. The young spore may be oval rather than spherical. I'll just explain this to you. See this picture. This picture, as you can see, it has some bacilli which have a spore, which have a, it's a drumstick appearance with a projection at one end, but some do not have it. The ones which do not have it are the young spores. And this picture is also showing how these are stained. Okay. So this is the morphology of this bacteria. Next, the cultural characteristics about it. Basically, this is an obligate anaerobe. It means that it grows in absence of oxygen and at a temperature of 37 degrees, so very well matching to our body temperature, and at a pH of 7.4. It grows on ordinary media. Blood and serum improves its growth. This is just to be memorized. Then growth swarms over the surface of agar, especially if the medium is moist. This means that the growth is, spread. It's floating. It's spread all over the surface of the agar. The selective medium to culture it is Robertson's cooked meat broth. Then on blood agar, if we culture it, alpha hemolysis occurs, which is then followed by beta hemolysis due to the production of hemolysin, that is tetanolysin. It's also known as tetanolysin. The biochemical reactions about this bacteria are that feebly it's proteolytic. It helps in the uh, breakage of protein, but no saccharolytic property. It does not attack on any sugars. Resistance. These are very resistant bacteria. These are not destroyed in the soil for years together. And with various other chemicals also, these cannot be destroyed. These can even be present on your clothes, in the plasters, in the hospitals, various surgical things which come out as waste from the patients. It can be there also, and it cannot be easily destroyed. For killing these, the most reliable method is autoclaving. These are very resistant spores and can only be destroyed by autoclaving. Three types of toxins are produced by this bacteria: tetani, tetanolysin, which is also called hemolysin, basically because it lyses the erythrocytes. It is not very much relevant in the tetanus pathogenesis, but is antigenically somewhere related to Clostridium perfringens. Then the second toxin this bacteria Clostridium tetani produces is tetanospasmin. This is the major toxin which is responsible for causing tetanus. Tetanospasmin is a neurotoxic, oxygen stable, and is neutralized by antitoxin. This is the major toxin which is responsible for causing tetanus. Another toxin which is found in the body is non-spasmogenic, peripherally active neurotoxin. Now, it is present, but its role in pathogenesis of tetanus is not very well known. Then we come to the pathogenicity. Pathogenicity is an important topic. How tetanus occurs after the attack of this bacteria. Tetanus results basically from the infection of a wound or raw surface with the tetanus bacilli, or from the parenteral infection of contaminated surfaces. It means that it occurs into an open wound. If a wound comes in contact with this bacteria, it can cause the illness. Clostridium tetani has little invasive power. It means that it can be easily, it can be destroyed, but then it it has not it is does not have it has a very little invasive power. From clothes, from the things, if we wash them, then it does not harm. It can be washed. Then next we come to the flow chart telling us about the pathogenicity. So in favorable conditions, the spore implanted in a wound germinates and multiply. When it comes in contact with a wound, when this bacteria comes in contact with a wound, it germinates there, it grows there, it multiplies there. The toxin it produces, the three toxins I told you, the tetanospasmin was the major one. Okay, so the toxin produced locally by this is absorbed by the motor nerve endings and then transported to the central nervous system along the axis cylinders of the peripheral nerve. Basically, it travels there. Then the toxin is specifically and avidly means very, very, dearly. The toxin is specifically and avidly fixed by the gangliosides of the gray matter of the nervous tissue. The toxin attaches to the Gray matter. The toxin is specifically and avidly fixed by gangliosides of the gray matter of the nervous tissue. Then after this toxin blocks the synaptic inhibition in the spinal cord. Basically, it inhibits the relaxation of the muscles. The toxin specifically blocks the synaptic inhibition in the spinal cord, presumably at inhibitory terminals that use glycine as a neurotransmitter. And this abolition of the spinal inhibition is responsible for causing uncontrolled spread of impulses initiated anywhere in the CNS. I'll explain this to you in simple terms also. This results in muscle rigidity and spasm due to the simultaneous contractions in the absence of reciprocal inhibition. This basically means that the toxins act on the nerve endings and the spread takes place to the central nervous system. Then action occurs on the gangliosides and the synaptic inhibition of the spinal cord is blocked. This results in spasm and muscle rigidity. This is because the feedback inhibition of muscles is blocked and the action of the antagonist and agonist muscles is not coordinated. So the result is that the muscles remain in a contracted state and they are not able to relax. This picture can briefly show the mechanism of action of the tetanus toxin. Excitatory transmitter, and this is the inhibitory transmitter. In this, the bacteria lodges here, and the inhibitory transmitter release is blocked, but there is continuous stimulation by excitatory transmitter, but the relaxation does not occur because the inhibitory transmitter release is blocked. So this is basically the pathogenesis, how it occurs. Now briefly I'll tell you about the disease tetanus, which is caused due to this bacteria. Tetanus is basically characterized by tonic muscle spasms. The muscle spasms occur in this, usually commencing at the site of infection and in all but the mildest cases becoming generalized, involving the whole of the somatic muscular system. Disease follows injury. It occurs after an open wound, which may be too trivial to be noticed. It's not necessary that it is present in it occurs due to bigger wounds only, but even the trivial injuries, if they get infected with this bacteria, tetanus can result. So what type of wounds can it be? These can be puncture wounds, mainly. This is the important thing, puncture wounds and unhygienic practices. These are two main things to be remembered. Puncture wounds are the major reason. Then while in surgical operations, there is a lot of when surgeries occur, there are open wounds. If the instruments are not sterilized and appropriate precautions are not taken, so there are chances of the illness. Then local suppurations such as otitis media, otogenic tetanus is caused due to this. Then Basically the tetanus caused in this case is known as otogenic tetanus because it has been caused due to otitis media, local separations. Then unsterile injections can be one cause, another cause. Then unhygienic practices, as I told you, such as the application of cow dung on umbilical stump. This occurs in the rural areas where they have a ritual or a custom of doing this, but this can lead to illness. Or certain rituals such as ear boring or circumcision. In this also there are wounds, but appropriate hygienic precautions are not taken, so the illness can be caused because this bacteria is found in soil, and if it comes in contact with any such wound, the disease, the illness, tetanus can occur. Tetanus has been found to be an important complication of septic abortion. This you must remember as from exam point of view. Okay. Clinically, how you see this? Clinically, tetanus is characterized by muscular rigidity. When you see a patient, he has immense muscular rigidity, which persists throughout illness, punctuated by painful paroxysmal spasms. Muscular rigidity, there is muscular rigidity, and in between painful paroxysmal spasms come and go. Okay, punctuated, it's written punctuated by painful muscular spasms of the voluntary muscles, especially the masseters. It affects the masseters, causing trismus or lockjaw. This is the earliest manifestation, first manifestation, earliest manifestation. Then another thing, the facial muscles. When it affects the facial muscles, it causes rhesus sardonicus. Then it affects the muscles of the back and neck, causing opisthotonus, and also of the lower limbs and abdomen. And when these features occur, death can also occur, and this disease has a very high mortality rate, from 40% to 80%. Earlier it was up to really 80%, but these days, due to the practice of various hygienic measures, it has decreased. The mortality rate has decreased, but still it's not very much decreased. It still ranges from 40 to 80%. We take a range. So death in cases of tetanus occurs due to spasm of respiratory and laryngeal muscles. Since spasm and muscular rigidity are occurring, so if these occur in respiratory and laryngeal muscles, death occurs due to that. Incubation period of tetanus is 6 to 12 days, but it varies from 2 days to several weeks. So there is a wide range, right? Then this incubation period is influenced by site and nature of the wound. That where is the wound, what is the nature, big or small, and the site. Then the dose and toxigenicity of the contaminating organism, how much dose and how much toxic it was. Then it also depends on the immune status of the patient. If the immunity is good, the prognosis would be good. If not, then accordingly. Then prognosis is grave when the incubation period is short. Okay. So prognosis is greatly determined by the incubation period. The interval between the first symptom, which is usually trismus, as I've told you that it is the earliest manifestation. So the interval between the first symptom, usually trismus, and the onset of spasms. This also determines the prognosis of the case. Then mortality is very high. I told you 40 to 80%. Lab diagnosis. No, actually, the bacteria is not easily demonstrated in the lab findings. So no laboratory findings are characteristic in case of tetanus. Diagnosis is clinical on basis of symptoms and the presentation of the patient, and it does not depend on bacteriological confirmation. Clostridium tetani is recovered from wound only in 30% of cases and can be isolated from patients who do not have tetanus. On demonstration of Clostridium tetani by microscopic culture or by inoculation is done, but then these are not diagnostic. Okay? No laboratory findings are characteristic of tetanus. Cooked meat tubes incubated at 37 degrees Celsius and subcultured to 1/2 of blood agar for 4 days. After this, swarming is seen. I've told you it floats. Swarming means it forms a layer. It floats on the agar. Prophylaxis. Prophylaxis is done in 2 or 3 ways basically. So first is surgical attention, removal of the foreign bodies. If it's causing the onset, or if it's still present at the region of the wound, so it is removed. The removal of foreign bodies is done, necrotic tissue and blood cells, to avoid the anaerobic environment, because this bacteria grows in anaerobic environment. So these have to be removed surgically. Medicines in allopathy, they are giving erythromycin, but homeopathic prophylaxis has its own benefits, which are very well given by Master Hahnemann. There are things written in the subject of Ognon of medicine. So homeopathic prophylaxis should be done by those guidelines. Then immunization is done for tetanus, active and passive. Briefly about this, what is passive immunization? This is done by injection of tetanus antitoxin, anti-tetanus serum ATS. Prior sensitization leads to hypersensitivity reactions, which may range from mild local reactions to serum sickness and even fatal anaphylaxis. Active immunization is by formal toxoid, plain toxoid, or absorbed toxoid. Then tetanus toxoid is given along with diphtheria toxoid and produces vaccine as triple vaccine, which you might be knowing, DPT vaccine. This vaccine is given in 3 doses intramuscularly with an interval of 4 to 6 weeks, and then booster dose after 10 years. Treatment of tetanus. Tetanus patients are isolated in special units in the hospitals to protect them from noise and light, which can provoke convulsions in them. There is a very easy contraction of the muscles, and it's widespread and it's affecting the whole body. So these patients are very easily affected by little stimulus like light or noise. So they are given isolated wards in human TIG. Anti-tetanus immunoglobulin diluted may be given by slow IV infusion. Antibacterial therapy with penicillin or metronidazole started at once in allopathy, but for us appropriate homeopathic medicine is to be administered. Now this slide shows in brief of what all I have told. See the first picture, which is showing the nails. These are things which can be responsible for causing the disease. Then the second picture shows the drumstick appearance of the microbe of the bacteria. Then the third picture briefly shows the mechanism of tetanus toxin. And these two pictures, Opisthotonus and Rhesus sardonicus, are the two clinical manifestations of Clostridium tetani. That's all for today's class. Please read this from your microbiology books. Thank you so much.